So we will now move on. So the first part of our panel, because we've got Professor Brett Sutton with us, the Chief Health Officer, and I'm not sure how long we've got with him. I thought what I'd do is put his questions up front right at the start so that he's got the opportunity to talk to you directly. So I'm going to be posing the questions. I'm just checking because I did see Brett come in, but yes, okay, fantastic. Are you in a car? Okay. Thank you. Okay, lovely. So Brett, so your first question is the TGA, which is the Therapeutic Goods Association, has provisionally approved vaccines for children ages 5 to 11 years. What does this mean, and how do we know these vaccines are safe for our children?
Thanks, Ellie, and lovely to speak to everyone. Yes, I'm coming to you from my car. I've got about 10 more minutes available. I hope I can answer a few questions. And I just want to express my joy at being able to speak to the South Sudanese community. I've never been to South Sudan, but I've worked in Kakuma refugee camp and Logachokyo. So I have met many of the South Sudanese community. If I remember correctly, I think it's Lodi as a greeting. I hope I've got that right. So the TGA is our regulator for assessing all medicines and other devices for use in medicine in Australia. They are very thorough in their assessments of all of the data around safety and how well things work. They assess each and every drug and medicine that's used in Australia, not just vaccines. And so they take all of the time that they feel that they need in order to make a recommendation that this medication, including vaccines, can be used in Australia. That applies to antibiotics, to medicine for blood pressure, to medicine for thinning blood, for medicine for strokes, medicine for heart attacks, anything you can think of. The TGA looks at the data and makes a determination that it's safe for use in Australia. And so when they look at vaccines for children, they will take all of the time that they need to be happy that they are satisfied that it works and that it's safe and that it's going to be something that can be given to healthy children across Australia in the age groups that they recommend. I have 3 children. They are 11, 9 and 6. And they will all be vaccinated in January. I'm looking forward to being able to give them that vaccine, knowing that the TGA is giving its approval, because I trust the TGA, because I know that they work through each and every medicine in Australia to be happy that it's safe.
Fabulous. Thank you so much, Brett. And it's really reassuring for people to hear that you're happy to give it to your own children. So the second question is, what is Omicron, so I can't even say it, Omicron variant, and what should we expect in terms of measures moving forward? Does this mean more lockdowns?
Look, I really hope not, but Omicron is a variant, a new version of coronavirus, of COVID-19, that is getting around our vaccine to a degree, not completely, but a little bit. And that means that it's spreading very quickly, because even people who've been infected before, people who've received the vaccine, can get this virus. One of the encouraging things is that it might cause more mild illness, so not as severe, but with lots and lots of numbers, lots and lots of people getting unwell. Even a milder illness could mean that we have lots of people presenting to a hospital, lots of people presenting to their GP. So we have to do whatever we can to slow down how quickly Omicron is moving across the population. It's moved very quickly in Europe, in South Africa. And so that means booster doses, because they will provide more protection, but it also means masks. It also means making sure that we have good ventilation wherever we go, to try and meet people outside, to try and have good airflow wherever we are, in restaurants, in our workplace, at home. But we don't know yet what it looks like. We know that numbers are increasing very quickly, and New South Wales has gone from a few hundred cases to over 1,000 in just a few days. And so if we have thousands and thousands of cases, we just need to be sure that we're doing as much as we can to protect ourselves and our families by getting vaccinated with the first 2 doses. But if we're due for a booster, to get that booster after 5 months.
Fabulous, thank you. So that sort of encourages us all to get the boosters, but also a really good point, Brett, that you made about not forgetting the basic stuff that we already know, which is the masks, the hand washing, all those, the social distancing, and trying to do things outside. So the third question we've got is, why do I need to get vaccinated just after I've recovered from COVID-19 infection?
So when you get COVID-19, it does produce an immune response. You produce antibodies, you have some protection from getting infected again, but that doesn't last, and it's not as strong as the protection that you get from a vaccine. So what we want people to do, as soon as they've recovered, not when they're sick, not when they're still unwell, but when they've recovered, to also get a vaccine to strengthen the immune response. So between the immune response from infection and the immune response from vaccination, you'll have even more protection from getting infected again. And what we've seen, including in South Africa, is that people have been infected in all of the waves of infection that have occurred there. Some people 2 times, some people 3, some even 4 times. And so if you're not getting vaccinated after getting infected, you could get infected again. And that's not good for you. It's not good for the people around you if you are infected again, and you could infect children, infect elderly people, infect people with medical conditions. And so that vaccination when you're well again is really important for that immune protection from getting serious illness with another variant like Omicron.
Fabulous, thank you. That is a really good answer for us, because we were all very confused about that within the community about why it was necessary. But that makes complete sense, that it boosts everything, and it makes a stronger barrier, I guess, to getting sick again. So one of the main challenges our communities have faced is observing certain cultural practices. And these are including things around births, deaths, and special days or festivals during the extensive lockdowns. So we will be asking the community questions around a harm reduction approach that I think is really necessary to protect cultural practice, but also to make communities more safe. So Brett, the question to you then is, what opportunities are there for communities to work with government to build culturally appropriate harm reduction strategies into public health policies?
Look, I hope there's real opportunity there. When we went through 2020, we didn't have a vaccine. We didn't have many options available to us, apart from stopping people from meeting other people in all kinds of settings, in restaurants, but also weddings and funerals and work, and even at home. So that was a really terrible option for us. Now that we're getting vaccinated and getting the booster, there are many options available to us, and we can see people face to face, and we can come together, and that's important and appropriate. But the risk is still there, and it's there even more with the Omicron variant. But I hope that there are opportunities, especially with the local public health units, and communities and community organisations should reach into those local public health units, and we'll let those community liaison and champions for called communities, multicultural communities, to be able to listen to what they need and what they want, and try and find some solutions. I think they're pretty simple. Some of it's allowing those practices to happen, but outdoors, or allowing them to happen, but with masks and with good ventilation. So it doesn't mean stopping them. It just means finding a path that they can happen as safe as possible.
Fabulous. Thank you so much for that. And we will definitely be in touch with those local area public health units to progress some of the work that we want to do in partnership, well, led by the community and having their voices heard with developing these strategies down the track. So, Brett, thank you so much for joining us. I know that you have to leave now. Was there any other comments or that you would like to make?
Oh, only to thank the community. It's fantastic to be engaged and fantastic that you're showing interest in this and trying to find solutions with us. It's really encouraging, and I just want to express my gratitude, and God bless everyone. Good on you.
Great. Thank you so much, Brett. Take it
Thank
easy.
you.
Bye. Have a good night.
Bless you too.